Hi, I'm Dr. Maxim Chumak, known as Dr. Max, simply Dr. Max. Let's talk about preoperative instructions. As you're probably aware that prior to any type of procedure, it is important to know what to expect and also to prepare yourself properly. With any procedure, any surgical procedure, which is hair restoration it is considered to be a minor surgery, but it's still a surgical procedure. There are a couple of things that we need to make sure that will not happen. We always ask to avoid taking NSAIDs, such as Motrin, naproxen, and meloxicam, and other NSAIDs except of Tylenol for at least 7 days prior to procedure. We also ask to stop taking multivitamins, and the reason is there are some vitamins that can increase or prolong bleeding. The same is true regarding herbal supplements. Some herbal supplement can prolong bleeding time, so it is impossible to tell what, because a lot of herbal supplements come as a mixture. So we always ask to stop any herbal supplements. During the preoperative consultation, we actually go over existing medication, and I will recommend which one to stop, which one to continue. Of course, depends on the primary care physician and importance of those medications. Fish oil is very important to be discontinued prior to surgery, as it can prolong bleeding significantly. So it is important to follow those guidelines. We typically see patients one day before the procedure, where we discuss and create a hairline design. We draw blood on that day to prepare for the PRP, and review one more time everything about the procedure, what to expect. We usually start our surgeries early in the morning, depends on the size of the procedure. We can start at 6 a.m. Of course, there are some medications that I prescribe preoperatively. Some of them are antibiotics, some kind of help to relieve any anxiety, and those are important medications to bring with you on the day of the procedure. We're also asked to arrive in the button-down short and long pants, because it gets a little cold during surgery. Of course, we can provide blanket, but of course, if you are in shorts, you're gonna be less comfortable. The entire procedure is after anesthesia has been administered. You should not feel any discomfort or pain. First part of the procedure is usually harvesting, and it's done with the face down, like a massage-like table. And once part of the surgery completed, which usually takes between 2 to 3 hours, the implantation is done in more comfortable position, sitting in what we call a zero gravity chair. And at that stage, you can watch TV, you can be a little bit on the phone, or you can just take a nap. In between harvesting and implantation, our patient will have lunch, take a little break of the procedure. The entire procedure will take anywhere between 6 to 8 hours. And what is important here, because we use advanced direct graft implantation, as well as FUE harvesting, as you probably know, done only by me, we're able to match the same time as most of the even FUT procedures, so it happens rather quickly. So with any questions regarding preoperative instruction, please don't hesitate to contact us, 954-945-2909.